Thank you so much, Leba. I welcome everyone to this session. Today, we are going to have the interactive session of OET speaking, and we'll discuss different scenarios of the speaking role play cards as well. Right. So I'm Gurminder Singh Gill. I'm a language trainer. I have been taking language classes for different uh, students groups, and I have taken teachers training programs as well. I'm a neurolinguist, I'm a researcher, and I welcome you to this interactive session today. Okay, so we'll start with a short note on building confidence in speaking. Uh, what are the different aspects that we would need to work on? So here we will talk about few pointers. So the very first point we would like to take is to understand the test format. Now, so guys, it's very important to understand the test format, how they are going to take a speaking test. Now, let's talk about the overall structure of the test. So speaking in OET would take approximately 18 to 20 minutes, where you will be getting a warm-up session for 2 to 3 minutes. Then they'll provide you first a role play card. You get 3 minutes for preparation. And afterwards, you get 5 minutes to complete a role play with your interlocutor or the examiner. Afterwards, they provide you second role play card. And again, you get 3 minutes for preparation and then 5 minutes of conversation. Now, let's start from the beginning, warm-up session. Now, what is warm-up session? So warm-up session can be understood as a session where they give you a chance to be relaxed in the hall in front of your examiner. We call it interlocutor. So in front of your interlocutor. Now, interlocutor may ask you some questions like basic questions like your identity, or maybe, they can see their proofs, and then they can ask you about your profession or any general questions regarding your profession, like the moment that makes you happy in working when you were working in your profession, and any hospital settings or related questions. Now we need to understand that warm-up session is not to assess any skills. It's just to make you relaxed, comfortable with the interlocutor. Now, warm-up is another way of interacting with the interlocutor. And the best part, in the warm-up session, you can try to judge a bit about your interlocutor, about your examiner, about the pace of speech he has, about the pronunciation, or maybe level of the understanding of language skills. And this will make you more comfortable when you will have your conversation with the interlocutor, right? And after warm-up session, now remember, warm-up session will not be assessed. It may be recorded in audio files, but it will not be assessed. Now, after warm-up, then they'll provide you first role play card. In the role play card, you are allowed to use pencil or pen to mark, to underline, or to make any note on the role play card. Now, in 3 minutes time, you have three chances, or you have three permissions. Number one, you can ask pronunciation for any difficult word if it's not clear to you. Number two, you can ask meaning of any word which is not relevant. Number three, even you can ask name of the patient if it's a known patient case. So in 3 minutes time, we can mark, we can underline, we can make notes on the role play card, we can ask pronunciation, we can ask for meaning and name of any known patient before you start your conversation. Right. Afterwards, then you need to have a conversation with the interlocutor. You get 5 minutes for the conversation. And here we need to speak for at least for 5 minutes. This is the basic scenario that OET want to see. Now, the whole conversation will be recorded possibly in audio files, and then they send these files to Australia, where these will be assessed. So interlocutors are not the assessors in the examination. They are the facilitators, right? Now, after first role play card, then they provide you second. Again, you have 3 minutes for preparation, and then you have 5 minutes for conversation. So this is the format of the test. Speaking test. Then next, regular practice is very important. So candidates, if you want to achieve good score in OET speaking, it's very important to practice it regularly. Now, there are some statements or phrases that we'll talk in next slides, which are a bit common in most of the role play cards, right? So if you practice again and again, will become robust in these skills, in these phrases. So it's very important to practice it regularly. And then we can try to simulate, or we can try to get a kind of test condition. I mean to say, what we call it mock test. So with the help of your expert trainers, you can get approximately result of your speaking role play cards. So try to do it in the same scenario that we find in on our test day, right? So exactly 3 minutes. First, we can go for warm up, and then exact 3 minutes for preparation, and then 5 minutes of conversation, and then try to get a probable score in the mock test. That's very important. Now, when you practice regularly, it's quite natural that you expand your vocabulary as well. So with the help of everyday speaking sessions or regular practice, you can build your vocabulary, which are quite relevant in OET speaking sessions. Right. Now, here, there are some specific phrases, or we call it clinical communicative skills, where these phrases are required. So we can use these phrases, we can expand our vocabulary. So this is the way when you're more, when you have different skills, when you know the format, you have practiced well, then we say we are ready for the test. And this is the way how we build confidence in speaking. Right. So let's move to the next part. Okay, so very interesting topic, OET in real life scenarios. Now here, I would like to point out this thing. One of our candidates, he wrote a review, he wrote a text, he said that after he cleared in medicine. So after he cleared the OET test, he said that I'm so confident in dealing with the patient. Yes, dealing with the patient. And he said so now I'm not hesitant to ask questions or to reply or to explain the procedures. And we have all the steps. Exactly. So this is how OET created this speaking test, which is exactly same in our real life scenarios as well. So guys, this is very important to develop our skills as well, how to interact with the patient. Now, what happens generally in countries, in a lot of countries where, a job of a medical practitioner under so much stressful conditions, limited time slots to provide to the patients, and sometimes a lot of other things, happening in the hospitals or in the healthcare setting. Now, we are not able to provide appropriate treatment in the sense, kind of how you interact with the patient, how you how you treat in general way, right? So sometimes we are not able to ask their actual reasons to visit. I mean, due to shortage of time, sometimes we don't ask a lot of questions so that we can get exact, cues of the patient. If he's hesitant or he has any other issues apart from the issues that can be seen in front, right? Sometimes patients uh, don't want to share everything with the doctors, even with the medical practitioners even. Now, this is how you make them comfortable, and you ask questions, you give answers in appropriate manner. And I'm sure a lot of people are doing this. Now, this is same what we need to do in OET speaking test as well. So I generally say this, that role play in the OET is just like a role play in your real life also. Now, let me be more clear with this. What we believe, that everyone has different roles in life, right? So when we are with our parents, we have a different role to play. We act differently. When we are with our colleagues, we have different roles to play. We act differently. When we are with our family, maybe our wife, our children, we are different. When we are with our friends, we are different. With our patient, we are different. So again, you need to create that mode that this is the actual scenario, what is going to happen in our OET speaking as well. And everything will be changed. You can perform the speaking role play card conversation in effective manner, that's for sure. If you try to play that role and just imagine yourself in that particular role. So this is how it's important in our real life as well. A lot of our candidates now say that now they are quite confident in the hospitals to talk with the natives, or to talk with the patients. This is how changed everything. Exactly. So let's move to the next part. Okay, so we'll see a role play card. I'm sure a lot of you must be practicing OET, or if you have not into this part, let me show you a role play card here. So this is a role play card, looks like. Here we have settings. Now settings where this conversation is going to happen. So that's called setting. It's written GP practice, general practitioners practice, or GP practice, we call it. Now, settings can be changed in different cards according to different situations. And then second point here, you find it's written doctor or any other profession. Suppose nurse or pharmacist or dentist, right? And then you can find some information here. It's written, you're seeing a patient who has frequent migraine attacks. Now, this particular information is called background information of the role play card. So background information, where you find information about the patient to whom you're going to have the conversation with, and you may find background information regarding his medical conditions, or sometimes social background as well, or sometimes surgeries which are planned and going to be happened in future. So background information tells you everything about the patient, and we can understand whether it's a known, unknown patient. Now, next, you can find task, and then you can find some bullet pointers. Now, this is the third part and the most important part of this card, of role play card. Now, here you can find your role and bullet points that you need to complete in the conversation. So, role play card is a kind of zigzag conversation. If you have a question, your patient, I mean to say your interlocutor, your examiner, would have the answer of it. So if I'm saying it's written, ask him to describe his symptoms. So your interlocutors or patient's card would have the answer of this particular question. Right? So this is the part of task. So there are three parts: setting, then background information, and then tasks. Right? So we need to complete these tasks in 5 minutes. Now, according to OET, if we have, for example, if we have 5 bullet points and we are not able to complete all in 5 minutes, there will be no negative marking for this. Yes, we need to make sure that all the pointers from the beginning should be in well-structured manner. And we have not unnecessarily exceeded any point or expanded any point. We need to be to the point. We should not add a lot of information from our side. Whatever is written, we just need to elaborate these pointers. Right. So we'll come back to this part. Let's move to the next, and then we'll have 4 more questions on this. Okay, so let's talk about common communication scenarios. So what are the different settings that we can find in OET speaking role play cards? Okay, so here we can find, so if we talk about different scenarios, there could be like hospital settings, maybe hospital ward, emergency ward, casualty ward, right? Or sometimes clinic, suburban general practice, or GP clinic, GP practice that we have already seen in the last slide, right? So these are the different scenarios that we can find in settings. Now, guys, here we need to understand what setting asks for. So setting plays an important role in understanding whether it's a known or unknown patient. With this, it also helps you in your introduction. For example, if I start my conversation with good morning. Good morning. My name is Gurminder, and I'm the registered doctor at this clinic. Now, the first setting is clinic, so I can say at this clinic. May I know your name, please? Then I may get the name. So, yeah, my name is John. Right, Mr. John, how can I help you today? Now, this is the way how I include setting in my conversation. So suppose it's suburban general practice, I can call it clinic, GP clinic. Now, next is home visit. Now, in home visit or patient's home, we are visiting at their home. So there we can use introduction. For example, good morning. Good morning. My name is Gurminder, and I'm the registered doctor at this community or at this community hospital or in this locality, right? Same with patient's home. Then we have medical center. Now here we can use like in this medical center, then we have hospital, hospital ward, general ward, then accidental and emergency. Sometimes you may find a short form, A&E department, casualty ward. Now, this is how we have different settings. in our speaking role play scenarios. Fine. Now let's move to the next part. Yes, so very important point, how you gather the information from the patient. Now, for example, in my previous example, I have already told you that how to start the conversation, then after greeting, how you introduce yourself, then we have to take introduction. Then I ask opening questions like, how can I help you today? What can I do for you? What brings you here today? There could be different ways of asking. A patient might be telling that, yeah, so I have a right-sided headache. It's quite severe. Now I have to gather information. I have to gather information, elicit information from the patient so that I can get a clear idea. I can provide a probable diagnosis of the condition before we have diagnostic tests. Now, here, first of all, I can provide empathetic statement or empathy. Oh, I'm so sorry to hear about this. I know it must be hard for you to deal with this situation, but don't worry, you are at the right place. We can definitely manage this. Now, empathy should not be a short phrase like, oh, I'm so sorry. That's it. No. So this is not the way how an empathetic statement should be. So empathetic statement should be a bit more expanded, like where you are understanding his problems and you are giving a kind of reassurance in the empathy that, yes, you are at the right place. We can definitely manage this. So this is how we empathize the patient. Now, let me repeat this. Doctor, I have severe headache. It's right-sided since yesterday. Oh, I'm so sorry, Mr. John, to hear about this. I know it must be hard for you to deal with this situation, but don't worry, you are at the right place. We can definitely manage this. Right. Now, it's very important, guys, when we empathize with the patient to use a proper tone, right, a proper voice modulation, and it should be sensed from your voice that, yes, you are actually empathizing. So another tip here, OAT is not going to watch your facial expressions in the audio files. They are just going to listen to your voice. So in your voice, like earlier, I said that a role play, right? A practical role play, act, 5 minutes act. So in that act, try to uh, be like in that moment, in that particular setting, in that particular scenario. And I'm sure everybody love, to be actors at some point. Maybe any movies, or any other person you would like to play the role of that person. I remember when I was in school, we used to play teacher's role. Yeah, like on Teacher's Day and other stuffs also, And we have short plays on the stage in some festives, and we used to play some roles. And this is how exactly we play the role. So information gathering, here we take permission after empathy to ask the questions first. So how do we take permission? There could be different ways of asking this, obviously. Mr. Johnson, if you don't mind, I would like to ask some questions for my better understanding. May I proceed? Okay, so if you don't mind, may I ask you some questions for my better understanding? May I proceed? So this is one way, right? There could be different ways of asking the same thing to get the permission of asking questions. Now, then we ask questions one by one. Now try to start questions with an open-ended question. Now, there are two types of questions. We can say open-ended and close-ended. Open-ended, where you ask a question and patient may have a chance to give you a lot of information in one go. I mean, in one answer. For example, close-ended is like where you ask a question and that's to the point, maybe yes or no answers, or maybe one phrase answer, short phrase. Do you have pain? He would say, yes, that's close-ended. Oh, are you still experiencing this? Yes, that's close-ended. May I know your age if you don't mind? Yeah, he says, I'm 30. Okay, so this is close-ended. Now, when I talk about open-ended, so open-ended, for example, so Mr. John, can you please tell me more about your condition? Yeah, he would say, yeah, so started yesterday. It's a kind of right-sided headache, and I have other symptoms as well, nausea, vomiting, and other parts. So this is how we start with open-ended question. And then we can go to the point answers, means close-ended answer questions and answers. Now, in that part, when you ask questions, there is an important technique that we need to follow. We call it active listening techniques. So this is how you show others that you are listening to them uh, actively. So this is what happened, at my home, that somebody was asking me, and I was like, goes with my other things, and uh, they thought like it's ignorance. I was listening to them, but I was not showing that I was listening to them. So here you need to show how actively you are listening, and this is how you go with this. Now, there are three parts of active listening techniques. Number one is paraphrasing. So you can paraphrase the answers. Paraphrasing means uh, to restate the answer in your own words, to restate the information in your own words. Now, there are a lot of people, nowadays getting research papers and try to do it in our own ways. And sometimes they make different text messages. ChatGPT is one of the, anyways, we'll not talk on more on that, but this is how you paraphrase. Now, in paraphrasing, you show that you have understood it clearly. And then you paraphrase in your own words. For instance, if I'm asking, okay, so Mr. John, please tell me about your dietary pattern. And Mr. John is saying, doctor, I don't like food at home. So most of the times I go out to have food from outside. Now, I don't like food at home. Most of the times I go out and have food from outside. Now, this is the answer. So I can paraphrase this. Oh, you mean to say that you rely on outside food? Now, I don't need to say word by word or in the same words. And the main point is not about don't like the food at home. It's about the dietary pattern, about the food. So he takes food from outside. So I can paraphrase it in like, so you mean to say that you rely on outside food. I'm not saying that you don't like food at home, right? So this is how you paraphrase. Okay, one more example. So please tell me about your daily routine. Well, doctor, it's, this headache is affecting my work. I'm not able to focus on my work. Uh, I can't focus due to sensitivity of bright light and sunlight. And even it's affecting my walking as well. I'm not able to walk in confident manner. Okay, so personal life is also affected. Now, let's paraphrase. So you mean to say that it's affecting your life, personal and professional life. So this is how I paraphrased the whole information in this particular sentence. So this is called paraphrasing. Next. So I hope you have understood this point, and If you have any queries, we can take at the end of the session. Next is back channeling. So back channeling. So when you're talking to somebody, it's quite natural to give response after listening. Okay, all right, I got it. I understand. Yes, it must be. Doctor, it's very hard for me to deal with this situation. Oh, yes, it must be. So this is how you back channel. So it's quite natural. I'm sure everybody must be doing this, obviously, and this is natural. So we don't need to focus much on this. We just need to think a bit on this, that yes, we need to do back channeling when we listen to the patient. Fine. Next, echoing. So echoing, where you can repeat a word or a short phrase from patient's answer. For example, if I'm asking, so how about your pain? And he says that, yeah, uh, this pain is affecting my walking. I have pain in my right leg, let's say, right leg. Now I can repeat a word like, oh, right leg, or phrase like right leg. Another example, uh, doctor, this is right-sided headache. Right-sided. Now, there is no fixed rule here in echoing that this particular word need to be picked. No. So whatever you think that is more appropriate or remarkable information, a word or phrase, you can just pick and repeat it. Now, it shows that you have listened to the patient actively. So all these three techniques can be used in the conversation. Now, remember, paraphrasing can be done once. Echoing can be done once or twice, and backchanneling throughout the conversation. Fine. So this is done. Now let's move to the next step. Okay, so before picking that point, I would like to talk about the next step. We call it information gathering. Afterwards, then information giving. So first we open the conversation, then we gather the information according to the cards, different cards, right? And then information giving. Now, whenever you start giving information, remember to take the step of checking prior knowledge in case if there is a medical terminology which is not common for a layman. For example, if I'm giving a diagnosis to the patient, like, so you had an MI or myocardial infarction. Now, if I introduce this term, I can check with the patient. So do you have any prior knowledge regarding this? If he says no, generally he would say no. And then I can explain if explanation is given. So this is how we check the prior knowledge. And it's one of the assessment criteria of information giving. Another example, uh, let's take an example of biopsy. So biopsy is not quite common, right? And we can use it as checking prior knowledge questions. So if you have this in the card, if it's written that biopsy, he would be undergoing biopsy. So then we can introduce this term. So Mr. John, so do you have any prior knowledge regarding biopsy? He may say no, generally he would say. And then we can explain if it's given. Now, same with other medical terminologies, which are not common or a bit complicated, right? So we can start with information, giving, then checking prior knowledge, right? Now, next is very important part. Just a moment, guys. So we have covered all these topics so far. Okay, so we have done active listening techniques. Now, it's very important. Now you can see a kind of triangle and then 3 steps. Now we call it scoring triangle. Scoring triangle in OET speaking. Yes. And this is the best part in the information giving scenarios. Now, let's see. First of all, it's written persuading and explanation. Now, when we talk to the patient, patient is asking something. For example, he says that uh, if he's worried about something, for example, doctor, I'm so worried about biopsy, right? So then I can use a persuading statement like, oh yes, Mr. John, I can sense your worries. This is called persuading. Now, another example, I know that you're worried. I know that you're concerned about this. So shouldn't we have an MRI first? Patient is saying, oh yes, Mr. Johnson, I know that you're worried about your condition. Now, when I start from his concerns, and then I move to the next step. So before answering or before explanation, we can use persuading statement. And then we can explain, we can suggest, we can advise. Now, explanation, for example, if I'm explaining something like, so this is the process and this is how we undergo, in this process and various steps. After explanation, or if I talk about suggestion or advice, for example, if I'm suggesting something that, Mr. Alex, you have to make lifestyle changes, which are very important for you at the moment. Try to incorporate fruit and vegetables into your diet. Now, I have suggested something. Now, after suggestions, then I can check with the patient whether he would be able to do this or not. He will follow this or not. So this is called next step checking with the patient. Now, I can suggest, so try to incorporate fruits and vegetables into your diet. So will you be able to follow this? Mr. Johnson, will you be able to follow this? Now, when I say this, will you be able to follow this or will you be able to do this? This is called checking with the patient. So I'm checking with the patient. So if I'm explaining something, I can check. So is this all right to you? I hope it's clear to you. I hope it's fine with you. I'm sure that you will be able to do this. So these are called checking statements. So is this plausible for you? So this is again called checking statement. So after explanation, we can use checking with the patient, check with the patient. Next, third step here would be encourage the patient to ask questions. Now, after checking, we can encourage the patient. For instance, so will you be able to do this in checking? He says yes. So, Mr. Alex, do you have any other concerns? Do you have any other queries? Do you have any other questions? Now, this is how we encourage the patient to ask questions. Now, guys, it's very important to encourage the patient so that he can ask questions and we can jump to the next point. So please remember, you will not complete all the bullet points by yourself. You can't jump from one point to another by yourself. You need somebody to assist you, to help you, so that we can jump to the next points, next bullet points. And here, it's the way how we can jump. If we encourage the patient, he can ask questions. So, doctor, please tell me about the treatment. And then our next bullet point treatment can be elaborated. Now, if he asks, so please tell me about the treatment, again, we will use persuading statement. For example, that's a good question. Oh, Mr. Alex, that's a relevant question. Let me guide you. Let me explain this to you. There are different treatment options available. Surgical, or even we can manage comprehensive manners. this is how we persuade, we explain, and then again we will check. So I hope it's clear to you. Next, do you have any other questions? Next, oh, that's a good question. I know that you're worried about this. Let me explain you this. Next, so is this plausible for you? Next, is there anything else I can help you with? Do you have any more questions so far? Now, this is how this triangle works. Now, this is the part of information giving, and we can use this triangle to make our patient more comfortable. Even when he asks questions, you will be able to move from one bullet point to another. And then this is how it works. Okay, so one more point with this. OET says that we need to follow chunk and check. Chunk means your information should not be too much in one go. You should not explain a lot of things in one go. So suppose if I'm continuously talking for 20 minutes or 20 seconds in the conversation, then I can take a check step. So I hope it's clear to you. I hope it's fine with you. Then I can move to next. So this is how we complete chunk and check as well. Fine. Let's go to the next slide in the presentation. So after my explanations, if card is almost over, and I can check and I can encourage the patient to ask questions. If I ask, so is there anything else I can help you with? And he says, no. Now, this is where we need to wind up the conversation. So the way we started the conversation with opening statement, opening questions, now same way we can close the conversation with a closing statement. Just the way like we do in writing, closing statement. So here we can follow a kind of treatment like, I hope I have addressed all your concerns. Thank you so much. I hope I have addressed all your concerns. Thank you so much. So if I ask, do you have any other questions? He says no. Then I can follow the closing statement. I hope I have addressed all your concerns. Thank you so much. And then afterwards, I can close the statement. Okay, so here, we can talk on how to manage anxiety during patient interaction. Okay, so to be very clear, guys, I know that this is not something I can teach. Obviously, you have been doing wonderful things in your life, and you're managing everything. Your own healthcare profession is not an easy task. I know that. Right? And you must have managed a lot of things in your life. And in fact, in today's world, in so much stressful conditions, we must be knowing this, how to do this. So I'm just putting few points here. I mean, these are not new points, obviously, for all of you. Just a kind of reminder. Okay, so let's move to this. Okay, so first, preparation. So guys, preparation is very important. So whenever you appear for this test, it's highly advisable that you prepare well. There shouldn't be any loophole in the preparation. If I'm not ready with my preparation, and with the test, I think I may have that kind of anxiety. So if you have prepared well, you know that you know everything, you have covered all the topics, I think this would help in managing the anxiety. Right. Next, relaxation techniques. Okay, so I can't teach you this seriously. This is something you know already. So there are different techniques, right? Like deep breathing exercises. It helps a lot. Few of my candidates told me that they use black chocolate to be relaxed before examination. Okay, so this is another example if you want to try, or if you have something else, you can even share with us. Would love to hear about that. So there are different techniques, right? So breathing or just visualization is another technique. You can just sit, close your eyes, and visualize yourself in that scenario and your performance, good performance. So you can do that as well. Next. So positive reinforcement, again, that's very important. And this is what I have been telling you, that this is not something which is not done earlier by anyone. It's not Mount Everest where nobody has climbed yet, right? Lot of people have already done this, and this is not a new thing for anyone in this world, right? So, and in fact, in everyone's life, we all have done a lot of things in life. We cleared so many tests. That's the result. Today we are here, right? We are in this stage in our career, in our lives. So just remind yourself about your achievements, about your test clearances, about your success stories. I'm sure everybody got all these stories. So we have already done a lot of things in our life. This is not something, which cannot be done. So just prepare well, relax yourself, and then reinforce. Remind yourself that you are the one who have already done so many things in the life. Right. Next. So now we are at this point where we can take uh, questions from the candidates, and I'm here to answer. Right.
If anybody has questions, they may write in the chat box. And also, I would encourage everybody to unmute their microphone and speak to Mr. Gurminder. Nobody has questions? Okay, so there's a question. Could you please explain about active, what was it? Active listening, yeah.
Right. Okay, so here, active listening technique means how actively you're listening to your patient, and in the conversation, in the role play, you're showing this as well. Now, what I'm trying to say that it's not that we don't listen everyone and we don't comprehend, we don't understand. Now, sometimes we are not able to show others that, yes, we have listened, you know. Now, in OET, it's important because it's a test. So we have to do it in our action. We have to show this in our actions. So when we listen to somebody, when we listen to the patient, we have to show this through three parts, three ways. So there are three ways: paraphrasing, back channeling, and echoing. Now, we should show these so that OET can understand that, yes, I know how actively, and I can show active listening techniques in my conversation. So 3 ways: paraphrasing, where you change the information in your own words and repeat it, restate it. Back channeling, where you give response after listening to others. Like, it's natural, we generally do this. We talk to our friends and we say, okay, fine, all right, yes, I got it. This is called back channeling. And then echoing, you can repeat a word or short phrase from patient's answer. Like, so I became sensitive to bright light and sunlight. Oh, sensitive. When I say sensitive, it means I have picked a word and I listened it properly and I have understood it. So this shows that I'm listening the patient, actively. Yeah, I hope it's fine.
Yes, thank you. Sir, there is another question. If the patient is speaking and they're not ready to listen to the doctor, then what's the proper way to interact?
Right. That's interesting. Sometimes you may get, irate patients, or you may get kind of reluctant patients. Now, guys, we need to understand one point, even in our life also, we understand this point that if somebody is reluctant, if somebody is not trying to listen, there might be some reasons behind it. Now, we need to understand that particular reason why he's not ready to understand. Now, this is what happens. Sometimes I'm trying to put everything on the patient from my side, and I don't see the exact reason why the patient is reluctant to this particular point. I give an example. Suppose if I'm asking a patient to have a bath, he's hospitalized and he's not ready to take bath. And I'm requesting the patient to take bath so that, and patient is saying that, doctor, I don't want to do it because after a few days, I will be discharged from the hospital, right? And now this is not the exact point that he might be having because of, uh, this particular reason that he's saying that I don't want to take bath. So there could be something else. Now, what was the reason in this case? The patient was having pain on the surgical site. And that was the reason he was not willing to move. So once you elicit the information, once you gather the information from the patient, so be calm, be relaxed, and make him calm that, Mr. Johnson, I can completely understand your situation. So if you don't mind, could you please tell me what's exactly stopping you? What's the exact reason behind the ignorance of this? Be a bit more politer, right? Try to elicit that particular information. I'll tell you one more scenario. Suppose if patient is willing, if patient wants to be discharged right now from the hospital, he didn't want to stay here, and I'm trying to tell him that you need to stay here for your treatment. He's saying that I'll continue my treatment at home, so let me go. And I'm saying that no, you can't, uh, continue your treatment at home because there are a lot of equipments required in the hospital. A lot of staff members are here. And he says, if I need, I'll come back. I'll call somebody, emergency services or something. Now, this is what I'm doing. I'm just trying to put everything from my side on him. And he's just ignoring the things. Why? Because it might not be the exact reason. What was the reason? In this case, patient was hospitalized for the first time in the hospital. And the ward was noisy and full of confused patients. And it was making him uncomfortable in the ward. So here, politely, I can ask the question. So, Mr. Alex, if you don't mind, could you please tell me what's exactly bothering you? in this hospital or in this ward. He may reject once or twice, and then he may tell you that this is the reason. Then I can offer him to, shift to the another ward or another personal room or private room. Right? I hope it makes sense, guys.
Thank you. We also have another question from Dr. Munazza. So the
Right.
question is, when I ask the patient, is there any question you want to ask? And the patient keeps asking questions. Should I keep answering them even if they're irrelevant, or should I minimize to keep up with my checklist of role play?
Okay. Okay, Dr. Munaza, it's very important to understand that there are possibilities when some questions or some pointers are different in both the cards. So sometimes if you don't have that particular answer, particular pointer, which is directly connected to patient's question or patient's explanation, we need to answer. Now, in the test, in the real scenario of the test, what would happen? Your interlocutor would have bullet points, and it's their duty also to be to the point and stick to the card. So we cannot think that the patient or the interlocutor is asking irrelevant questions, which are not in the role play card. So we need to answer. Yes, there are possibilities that we may answer a bit kind of irrelevant, you know, what we think is irrelevant. But patient's side may be a kind of relevant question from him. There is a criteria in the assessment, we call it understanding patient's perspective. So why this particular patient is asking this particular question, we need to understand the perspective of that patient. There might be some connections between the previous bullet point or the next bullet point, and then he's asking irrelevant, sort of irrelevant, what we are saying irrelevant, could be a relevant question from his side. So it's important to answer, right? And try to stick to your conversation structure. If the answer is not given in the bullet point, still try to stick to the structure of the conversation, not to the bullet point, obviously. So this is how you can handle this particular point. Yeah. Yes,
Okay, thank you. There's one more question. How to chunk and check in conversation when what phrases to use generally?
Right. Well, there could be a lot of phrases. Chunk means where you are not giving so much information in one go. If it's a conversation, I should not speak for more than 20 seconds or 30 seconds, sometimes 35 seconds, depending upon the explanations. Now, if I speak a lot, it means I'm not giving chance to the other person to speak, to take participation in the conversation. So it will not make it a conversation. We need to understand a kind of speech and a kind of conversation, both are different. In speech, you can speak like in one go, but when you have conversation, you need to give other person a chance so that he can contribute in the conversation. So once you feel that now I'm talking too much in the conversation, more than 20 seconds, 25 seconds, then you can just take a pause and check with the patient. So checking phrases can be different, like, I hope it's clear to you in the explanation way. I hope it's fine with you if I'm saying something that you have to, uh, do this in suggestions, in advice. So will you be able to follow this? Will you be able to do this? In the positive manner, even I can say, instead of asking, I can say like, I hope you can do this. I hope you can follow this. I'm sure that this will help you a lot. Right? So these could be different phrases. Now you can use some more phrases. So in general, but relevant in the same context. So no fixed statements. Yes, you can use different phrases which are relevant. Sadia, yes, I think this is fine.
Okay, so I don't think so. We have any more questions? So I would love to have everybody's valuable feedback for today's session. Could you please write in the chat box about today's session?
Even I would love to hear.
We would love to hear your thoughts.
This is what motivates us,
Exactly. And also if there is anything like if we are lacking in something, so we should work on it, do let us know.
True. That's true.
Okay, so we have a few feedbacks. We have feedback from Dr. Manazar. Thank you so much, sir. Inabe, thank you so much, sir. It was really helpful for them. And we also have another from Ittihaj. Everything was elaborated well and well conducted. Thanks a lot for this session, Sir Gurminder. Looking forward to join more sessions of yours and Med Instutors. Thank you so much for your feedback.
Thank you so much. Thank you so much for the feedbacks.
Thanks a lot. So I think we're done for today.
Yes, Sadia, this is all.
Okay. Okay, everybody, take care. And it was so pleasure to meet you, Sir Gurminder, today. And also, thank you so much for this wonderful session.
Thank you so much, Sadia. Thank you so much.
Okay, everybody, stay safe and goodbye.